Hi, good afternoon, everyone. Thank you, Hong Kong Obesity Society, to invite me giving this presentation today. Some technical person will help me to flip my PowerPoint, so bear with me if PowerPoint slide is maybe faster or slower than my talk. So let's start on the first slide. What I'm going to talk about is debunking the myth of fad diets. Next, please. Today, I'm going to talk about what is fad diet, what are the common characteristics of fad diets, and what are the popular fad diets over the past few decades. And thus, I will focus on two common and most popular ketogenic diet, and the other is intermittent fasting, that is more popular without recent trend. And I will talk about the science behind, and at the end I will talk about take-home messages. Thank you. First, what is fad diet? Fad diets, by definition, is any diet plans that often promise fast and dramatic weight loss in a short period of time. It always involves temporary dietary changes within a short time, and is considered unhealthy because it's not only restrict the calorie intake, but it also restrict the essential nutrients intake. What are the common characteristics of a fad diet? First, as I said, it promotes rapid weight loss. It promotes losing weight from a specific part of the body. For example, it says that you will lose weight only on your tummy fat, and is usually based on recommendations on a single study or studies without peer review. And some fad diets even claim that you don't need to do any exercise. And fad diets also eliminate one or certain food groups, which, as I said, it eliminates the some essential nutrients. And it also claims that food can change body chemistry. For example, you eat a great food, and then it will help you to burn your fat faster. And these are the popular fad diets that we found in the past 100 years. For example, the first one, I'm not sure if you have ever drank this kind of soup, the cabbage soup diet. I remember when I was a teenager, my mom mixed this soup diet for herself, and I tried it, and I saw her drinking only this cabbage soup diet, which only contains cabbage, onion, celery, all different kinds of vegetables, and she can only drink this soup for the next for a few days in a row. Of course, you will lose weight from that, but at the same time, because the soup contains very little protein and is not advised to do. And the second one, which is still popular in the recent years, is the Weight Watcher, which was originated from around 1961. And it is the closest to the calorie restriction weight reduction diet. And it actually promotes you to reduce the intake of saturated fat, encourage you to eat more fruits and vegetables, and eat more lean protein. However, it's quite costly, and you will see that a lot of products, actually you can buy some frozen meals that name Weight Watcher that they can find in the grocery store. And the next one is Slim Fast. Slim Fast is actually a meal replacement program that you are allowed to drink a shake to replace 2 meals in a day, and then you can still enjoy 1 meal a day with normal food. And it also encourages you to take 3 snacks a day. They even have a lot of Slim Fast products, the snacks, the protein bar, the granola bar, and they are quite good in taste. However, the price is quite costly. And some people still use it with similar or different brands, but as I said, this one, the price is expensive, and you won't stick with meal replacement for a long time, right? So and the next one is Fit for Life. Originate from 1985. I remember I have this book at home. My mom read it, and then I read it, and when I was a teenager, before I studied university, I found that a few points of the Fit for Life is that the writer Marilyn Diamond claimed that you cannot eat carbohydrate and protein at the same meal, and it claims that the water intake at the mealtime will dilute your digestive juice, so they are not allowed to drink plenty of fluid at mealtime. But the good thing is it promotes you to eat a lot of fruits and vegetables. However, it also say that dairy products are not good for you because of the allergic properties. However, we found that it is quite a fat diet, and a lot of studies have proven that it's not good enough. So the next one is Atkins diet. I know most of you have heard about Atkins diet. It's actually a high protein, low carbohydrate diet, and many other diets actually diverge from it, from like a South Beach zone diet. They are all very similar, that you eat a lot of protein. However, at the same time, you restrict your carbohydrate intake. Is quite popular during the 90s. And the next one is ketogenic diet, is quite popular nowadays. Still, but it was starting from 1920s that people use it to treat epilepsy, and with a lot of science, solid proof that it works for treating epilepsy. However, these few years, people are mainly using it for weight reduction. I will focus on the last two diet, which is ketogenic diet, and the next one is intermittent fasting. That intermittent fasting is also quite popular these days, and there's a lot of studies going on, even though some may not be good quality studies. But I will focus on the last two, which is ketogenic diet and intermittent fasting, so that you know more about the science behind. Next slide, please. First, ketogenic diet. Next, please. What is a ketogenic diet? Ketogenic diet used to treat, as I said, 100 years ago for drug-resistant epilepsy, especially in children. Compared to a traditional diet, which we normally use high carbohydrate, about 15% of our total calorie intake, when we eat carbohydrate, our blood sugar increase after a meal, and blood sugar is our major energy source. Versus a ketogenic diet is very high in fat content, but limit the carbohydrate intake. And with this, you have very low blood sugar, but at the same time, it promotes the body to break down the fat and produce ketone body as our major energy source. As there's very little blood sugar after eating, or there's no blood sugar provided from the food, so our body starts breaking down stored fat and produce ketone body, and this process is called ketosis. Ketone diet is actually rich in protein and fat, which includes meat, eggs, processed meat, cheeses, fish, nuts, butter, oil, seeds, and fibrous veggies. However, as we know, that it is not sustainable. Why? Because think about, in 5 years, can you do the same diet, avoiding carbohydrate? So I found some systematic review over the past years. The first one is published in 2013. It includes 13 randomized control trials of ketogenic diet versus low-fat diet. It includes almost 1,600 subjects. Most of them, like 61%, are from women with BMI between 30 to 43, obese women. And the keto diet group actually lost 0.9 kilo more than low-fat diet at 12 months and 24 months. And keto diet group also show greater reduction in triglyceride, diastolic blood pressure, and increase in LDL, which is the bad cholesterol, and also increase the HDL, good cholesterol level, than low-fat diet at 12 months or more. However, the studies, none of the studies show significant changes on fasting blood sugar, insulin, and glycated hemoglobin, which is the 3-month index of blood sugar control between the two groups. Next slide. Another systematic review published in 2019. It includes 11 randomized controlled trials of ketogenic diet versus low-fat diet. These studies include about 1,400 subjects, and also most of the subjects are women with BMI between 30 to 36. And it shows that ketogenic diet lost 2.1 kilo more than low-fat diet at 6 to 24 months. Keto diet also shows similar patterns on biomarkers. For example, it has greater reduction on the triglyceride and greater increase in the HDL and the LDL cholesterol. And similar pattern find that none of the studies show significant changes on the fasting blood sugar, insulin, and glycated hemoglobin between the two groups. Many studies, and they are not necessarily good quality, show positive effect of keto diet in people with type 2 diabetes in the short term. However, there's no long-term study, so we still have to do more good quality studies to prove that keto diet is good for the type 2 diabetes. There's no systematic review or meta-analysis or randomized controlled trial examine the mortality or cardiovascular disease of ketogenic diet. A prospective, the previous slide, please. A prospective cohort studies was published in 2018 showing that long-term low carbohydrate intake might be associated with increased mortality. Actually, the studies say that a U-shaped association found with people on very low carbohydrate and very high carbohydrate diet, both associate with increased mortality. And the minimal mortality risk people are those people who eat like 50 to 55% of carbohydrate of the total calorie intake. Next, please. And at the end, does the keto diet work? Yes, but only 1 to 2 kilo more compared to traditional low-fat diet. And it's hard to follow and adhere. For example, according to the recommended dietary allowance of carbohydrate for children and adults should be 130 grams of carbohydrate per day versus most ketogenic diet. To start with, they only allow to eat 20 to 50 grams of carbohydrate per day. And from the meta-analysis that I showed before, that ketogenic diet actually not good for people with high LDL cholesterol because ketogenic diet increase the LDL cholesterol, which is one of the promote the high risk of cardiovascular disease. And we know that the adverse effects are common for people following a ketogenic diet. For example, the first few days you will experience flu-like symptoms like runny nose, dizziness, and for long-term intake of ketogenic diet, people experience constipation, bad breath because of the ketone bodies. They have more muscle cramps, they have headache, diarrhea, fatigue, and skin rash. And the next diet I'm talking about intermittent fasting. Next, please. What is intermittent fasting? It is an eating pattern that cycles between periods of fasting and eating. And there's three most common methods we found. One is the time restrict fasting, which some people call it 16-8, meaning that you only eat 8 hours in a day in the 24 hours period, and the rest of the 16 hours you fast. And that 8 hours, you just choose that 8 hours that match your schedule. For example, you can start eating at noon and finish eating at 8 p.m. And from 8 p.m. till the next day at noon, that you don't eat anything except water, coffee, and tea. The next one is complete alternate day fasting, which we call it eat, stop, eat. They ask people to fast 24 hours once or up to 3 times a week. The third one that more people following it is the modified fasting regime, which is the 5-2 regime, that you can eat 5 days in a week normally, and 2 days eat only like 500 to 600 calories per day in a week. And the most popular and easiest to follow is the 16-8 method, which you can find just 8 hours within a day that you can eat normally, and then another 16 hours that you just stop eating and just drink water, coffee, and tea. And when you eat the first 8 hours, after eating, you increase the insulin that promotes the storage of sugar in the liver and produce fat in the liver. And when you fast and not eating during the 16 hours time frame, obviously you decrease the insulin secretion, and it promotes the burn stored sugar and fat from your body. Next, please. I found some systematic review about intermittent fasting, which one of them is published in 2018. And it only includes 2 randomized controlled trials and 4 pseudo randomized studies of intermittent fasting, at least 1 day in a week with less than 800 kcal per day versus no treatment. The subjects, there are including 400 subjects with BMI between 26 to 33. But the studies are quite short in period. It's only between 3 to 12 months only. The intermittent fasting group lost 4.1 kilo more than no treatment group. And there's no significant difference for the liver profile between the groups. Next, please. Another systematic review showed that there's 12 studies between the intermittent fasting group versus the control diet group. And it includes 545 subjects with healthy adults without chronic disease. The intermittent fasting group showed greater reduction in BMI, fasting blood sugar, and insulin resistance compared to the control group. And next one, sorry. And next, please. So does intermittent fasting work? Yes. It shows that 3 to 8% weight loss over 3 to 24 weeks, which is a very short period of time, within 6 months. However, with intake of fewer calories overall, of course, you lose weight. Intermittent fasting lower the insulin level and improve insulin sensitivity. So for people with high risk of diabetes, it helps to prevent diabetes. If you stick with intermittent fasting method, that you feel more comfortable and more sustainable. For example, client who wants to still eat normal food every day, they can choose the 8-16 method that they only eat 8 hours a day. But you stick with that intermittent fasting pattern. But there's common adverse effect of intermittent fasting. First, you feel hunger and weakness, obviously, when you are fasting. It also promotes orthorexia, which is an eating disorder that involves an obsession with eating healthy eating. For example, a person with orthorexia, they talk about food all the time. They always obsessed with food. So this is quite interesting. And when you are fasting, study shows that it decrease the alertness. For long-term use, we found that a common side effect is like hair loss. It disturbs your menstruation period for women, and it also increased the anxiety and depression because it's kind of an anti-social. During that fasting period, you cannot meet your friends and eat because you can only drink water, coffee, and tea. Next slide, please. My take-home message is that fad diets are tempting but are unsustainable. Can you imagine yourself eating this same diet in 5 years or even 10 years? And meta-analysis show that lifelong changes in life and lifestyle is actually the best and healthiest approach for weight reduction. And be careful of the adverse effects from eating fad diets. Eating right and balanced help to prevent many health problems such as heart disease and cancers. So some fad diets claim no need to count calories and do exercise. Is that true? I don't think so. So if you restrict the calorie and promote calorie deficit by eating balanced food and do some exercise, this is the most promising and long sustainable way. Before you try any fad diets, we suggest you to consult a dietitian and see if it fits you. Next slide, please. And these are my references. I'm working in Hong Kong Sanatorium Hospital, and this is my team. We have 7 dietitians. In case you need to consult to seek professional help, you can come and see us. Thank you.